Hello and welcome to ERM. This is part 1 of beta blocker. We are going to use beta fish to remember beta blockers. Beta fish is a Siamese fighter fish who is good at blocking attacks. There are 3 types of beta receptors. Beta 1 receptors are present in heart. Remember, we have only one heart, so beta 1 air in heart. Beta 2 receptors are present in lungs and other organs. We have 2 lungs, hence beta 2 is in lungs. Beta 3 receptors are seen in adipose tissue. The fat globules margin can form number 3. Beta 1 and 2 receptors are the important ones. Remember, we have 1 heart and 2 lungs. Beta 1 receptors in heart and beta 2 receptors in lungs. Now let's see the mechanism of action. As per the name, it blocks the beta receptors from binding with the catecholamines. In other words, it blocks the neurotransmitters adrenaline and noradrenaline from binding to the beta receptors.
Adrenaline and noradrenaline stimulates us to get ready for fight or flight reaction. It increases heartbeat and contractility, causing a positive inachronotropic effect. It also increases blood pressure by vasoconstriction of blood vessels and expands bronchus of lungs for easier breathing. All these help us to run better. It also helps to enlarge your pupil size so that you can see distance better. All these will help us be alert and to escape a threat. The beta blockers does exactly the opposite. It relaxes everything, especially the heart. The rate reduces. The contractility reduces. It reduces the work of heart so that the sick heart rests better and heals well. It also reduces BP by vasodilatation. It reduces pupil size, causing miosis. But the downside is they can constrict bronchus, leading to wheeze.
Now, we are going to remember the uses of beta blockers. See the angry hitting on Tom cat for eating her beta fish. She often gets angry, leading to migraine and anxiety. Look at how old she is. She also has essential old age tremors. Despite these, she is so strong at hitting the cat. So the uses are migraine prophylaxis, anxiety and essential tremors. Remember these. Our angry granny has hit the cat so hard that the fish fell directly into his heart. You can see our naughty cat has swallowed a lot of fish and our beta fish is swimming in the heart. See, there are bandages on the heart. This is used to remember angina, myocardial infarction and chronic heart failure. See, there is also a ECG to help us remember arrhythmia. So in heart they treat angina, myocardial infarction, chronic heart failure and arrhythmias. Can you see the fish trying to wriggle out of heart through the tiny hole? This is used to remember HOCM, hypertrophic obstructive cardiomyopathy. You can see some fishes have escaped and reached the aorta. You can see the swelling in aorta. That is aneurysm due to aortic dissection. You can also see another fish stuck in the end trying to escape. This has caused pooling of blood and increased pressure. This is for systemic and ocular hypertension. So to revise, the uses are angina, myocardial infarction, chronic heart failure, arrhythmias, HOCM, aortic dissection, systemic and ocular hypertension. Next, we need to learn about their side effects. We can use the name itself to remember some of the side effects. B for bronchospasm leading to wheeze. E for erectile dysfunction. T for triglyceridemia, hypertriglyceridemia. A for altered awareness of hypoglycemia in diabetic patients. Usually when sugar levels are low we get palpitations, tremors and sweating due to catecholamines, but these responses are blocked by the beta blockers. Hence the diabetic patients may be caught unaware and faint without any warning. Blockers is used to remember worsening of heart block. We can use this image to further reinforce our side effects. Tom has successfully caught the fish and is frying in the pan with a lot of oil. Oil is to remind us of hypertriglyceridemia. There is a bottle of sugar to remind hypoglycemic unawareness. You can see a lot of smoke from cooking. This has caused breathlessness and wheeze in Tom. This is to remember bronchospasm. Beta blockers can sometimes cause the same problems we try to treat. Like headache, they can also cause anxiety due to nightmares, Prinz metal angina, worsening of acute heart failure, rebound hypertension when the drug is suddenly stopped. Let's again look at the image with Granny beating Tom. You can remember headache instead of migraine and nightmares instead of anxiety. In this image, remember Prinzmetal angina and acute heart failure in heart and rebound hypertension in aorta. Beta blockers reduce the contractility of heart, so it shouldn't be used in acute heart failure. It will worsen. But the same effect will be helpful in chronic heart failure. To summarize, beta blockers prevent adrenaline and noradrenaline from binding and acting on beta adrenergic receptors, reducing the heart rate, BP, etc. There are two types of beta blockers: non-selective beta blockers and cardioselective beta blockers. Cardioselective beta blockers act exclusively on beta-1 receptors in heart. These drugs can be given oral IV or as topical eye drops. They are used in angina, MI, chronic heart failure. Their heart rate reducing property is used in treating not just arrhythmias but also in thyrotoxicosis and pheochromocytoma. Beta blockers are also used in hypertension and glaucoma. Glaucoma is nothing but hypertension inside your eyes. Ocular hypertension. They reduce essential tremors, anxiety and migraine. Non-selective beta blockers cause bronchospasm, erectile dysfunction, hypoglycemic unawareness and hypertriglyceridemia. Both types cause bradycardia and hypotension. Paradoxically, beta blockers can cause the same problems they are used to treat. They can worsen acute heart failure and Prinzmetal angina. Few people can get headache and nightmares. It can cause rebound hypertension in stopping the drugs suddenly. Thank you for listening.